Hey everyone, Dr. Hayes Estes here, Premier Physical Therapy and Sports Performance. And it's been a little while since I posted up a new video. We've been a little busy here at the clinic. Plus, I wanted to kind of get a better grasp on how I wanted to efficiently talk about our subject today, which is pain. It's something that we obviously deal with on a daily basis. That's what we do here at physical therapy. We help people get out of pain and help them feel better and get back to doing the things that they want to do. So let's talk about what is pain. Pain, first and foremost, is 100% of the time, all the time, produced by the brain. It doesn't matter if you just twisted your ankle stepping off the curb or if you have had pain for years. It is always produced by the brain. Now, there are different stages of pain. There is acute pain, which is that pain that happened yesterday or has maybe only been going on for a few weeks or maybe 2 to 3 months. And at that point, there is some tissue damage that is associated with the pain. But still, that pain is produced by the brain. And then we have chronic pain. Chronic pain starts somewhere between 3 and 6 months. And what we know at that point is that the tissues that were originally damaged are healed. And so therefore, the pain that you are experiencing at that point is all from the nervous system. And there have been some maladaptations in the nervous system to cause your body, not you, but cause your body to behave in a different manner, to avoid certain things that your body and your nervous system thinks are going to cause more pain. So we know this from research that as we transition from acute pain to chronic pain, there have been these neuroplastic changes, these changes in the nervous system that then explain why people who have no signs of tissue damage from imaging shows nothing is wrong, you don't have a herniated disc, you don't have a tear in your muscle, that everything has healed, but these people still have pain. And this, as we know, is a maladaptive behavioral change from pain. So it's been a pain in terms of your behavior, but also in terms of the change in your nervous system, where your body now associates certain movements, activities, positions with being painful. And those who now present with this chronic pain, they've had this maladaptation to actively cope with the pain. And so what happens is the relationship is a mutually beneficial relationship between pain and the attention that we give to pain. And so this mutually beneficial relationship just keeps stacking up and kind of spiraling out of control, and where we don't actually address the issue, and therefore we feel like your pain, every single movement we're going to do, or any specific movement we're going to do, is going to continue to cause more pain. So what's happened, or what needs to happen, is basically our brain and our nervous system, they need to be retrained. They need to be retrained to understand that bending over to tie your shoes is not going to herniate a disc. Throwing a baseball, throwing a football is not going to tear your rotator cuff. Your body has just associated these movements, these positions with pain, and we need to gradually expose the body to these positions, to these movements, so that your body and your nervous system now recognizes that, oh, this doesn't hurt. I can go and lift up this box off the floor. I can bend over and tie my shoes. I can go play catch with my kid. So how do we get over this? Well, so in the early stage, potentially medications can help a little bit to kind of get going, get you over the hump, and allow you to do a little bit of activity. But medications need to be tapered off over time so that we don't become reliant upon them. The other thing we need to address in terms of pain is emotional well-being. Your thoughts and your emotions can have positive or negative impacts impact on how you feel and how much pain you have. So if you're having a bad day emotionally, well, guess what? You're probably going to have some more pain. So addressing these thoughts, these concerns, can help better manage your pain. Diet and lifestyle, they also play a role. So, not eating like crap, not drinking a ton, not smoking, all these things can help in terms of reducing the amount of pain that your body experiences. And then on top of that, there's a deeper look into what was going on in your life at the time their pain started. Did you have a grandparent who just passed away when you went and you hurt your back playing basketball? Did your dog die? Did you get in a car accident and your favorite car that you've had since high school was totaled and now that car is gone and you're upset at the loss of that car, and now you have pain and you've had pain for 2 years because that you can't get over it? All of these things, they play a role in terms of how you perceive the pain and how you respond and actively cope with it. So if you associate these things with pain and you can't get over it, basically, then the pain is going to persist, or it's going to be a lot harder for you to get over the pain and recover from it. So these are things that need to be addressed. Lastly, and what we specialize in is physical activity, gradually exposing your body to the things that you thought were going to cause pain. Look, if you've had back pain for 2 years and you don't want to deadlift because you think you're going to herniate a disc, guess what? I guarantee you already have a herniated disc, but that herniated disc is no longer causing your pain. The original injury within the first 3 months, give or take, has healed. So your herniated disc that you have now is not what's causing your pain if you've been having this pain for multiple years. That pain you're experiencing now is, again, that change in your nervous system. And now you've associated bending over and picking something up with something that's going to cause you more pain. So here in physical therapy, what we do is we kind of say, hey, look, how about we go and try to just pick up this light box that weighs about the same amount of the groceries that you carry in every single day from the grocery store. And then maybe next week, we'll see if we can pick it up all the way from the floor instead of picking it up off of the box. And then maybe next week, let's see if we can actually pick up some weight. So we gradually expose you to the activities that you thought were once going to cause you pain. So are we allowed to then also exercise with pain? Yeah, in short, we are. So a little bit of pain is actually okay. We don't want to completely ignore pain, but at the same time, a little bit is okay. You're not re-injuring yourself just because you have pain. Pain does not mean that you're doing some sort of permanent damage. So if you have chronic pain and you come into physical therapy or you go and you exercise and you have a little bit more of that pain, it's okay. You haven't necessarily done anything. You haven't re-torn that rotator cuff. You haven't herniated that disc again. Your ACL hasn't blown up. Your body is just saying, hey, what are you doing? I've been avoiding this for the last 5 years because it's going to hurt. No, you're okay. You're under guided supervision. You're with doctors of physical therapy. We will gradually get you back to doing those things. So you got to move. A little bit of pain is okay. And you have to address all of the emotional aspects that are going on in your life around the onset and throughout your course of recovery. And through gradual exercise, gradual exposure, we will get you back to doing the things you want to do. Are you going to find that at a place where you're being seen with multiple patients at a time? Probably not. So that's why we are always one-on-one. We're one-on-one. We have doctors of physical therapy who are educated and well-versed in pain science, in getting you over that chronic pain. So if you're in pain and you're not able to do the things you want to do, if you've been avoiding doing the things that you love to do, whether you had pain that started yesterday or whether you've had pain that has been going on for decades, go see a physical therapist, go see a doctor of physical therapy. They'll help you feel better. They'll help you move better. Help you get back to doing the things you want to do.